I'm about to share something that may surprise you. There could be something in your bathroom cabinet right now that affects your heart more than you realize. Not rare drugs, not experimental treatments, but everyday medications. The kind millions of people take without a second thought. Pain relievers, stomach pills, cold medicine, even common supplements. Most people assume that if something is sold over the counter or prescribed routinely, it must be completely safe. But after age 60, your body changes, and the way your heart responds to certain medications changes too. By the end of this video, you'll understand which 5 common medications may put extra stress on the heart, why the risk increases after 60, and what smart, practical steps you can take starting today. This isn't about fear, it's about awareness. Let's begin with something found in almost every home. There are 5 common pain relievers: NSAIDs, the ibuprofen, naproxen, diclofenac. They work. That's why people love them. But here's what many don't realize. Regular use after 60, especially with high blood pressure or existing heart concerns, can increase cardiovascular strain. Back in 2005, the FDA required stronger warnings about heart attack and stroke risk on many of these medications. Yet millions still take them daily. Why does risk increase? NSAIDs reduce inflammation by blocking specific enzymes. But those same pathways also support kidney function and blood vessel balance. This can lead to fluid retention, elevated blood pressure, increased workload on the heart. Imagine your heart as a pump. If the volume in the pipes increases and pressure rises, that pump has to work harder. A younger heart may tolerate this. An aging heart may struggle. Important detail: risk increases with higher doses and long-term use. This doesn't mean never take them. It means use the lowest effective dose for the shortest necessary time, and always review long-term use with your healthcare provider. Now let's move to something that might shock you even more. 4. Stomach acid blockers, PPIs, omeprazole, pantoprazole, lansoprazole. These are among the most prescribed medications in the world. They reduce acid, they relieve reflux, they're often taken for years, but they were originally designed for short-term use, typically 4 to 8 weeks. Long-term suppression of stomach acid can affect nutrient absorption. One key nutrient: magnesium. Magnesium plays a critical role in maintaining normal heart rhythm. Low levels can increase the risk of rhythm disturbances. Some observational studies have also suggested a possible association between long-term PPI use and cardiovascular events, though the exact mechanism is still debated. This doesn't mean PPIs are dangerous. It means long-term use should be periodically reviewed. Ask, do I still need this daily? Can I step down the dose? Can lifestyle adjustments help reduce dependency? Never stop abruptly. Tapering may be necessary. Now let's talk about something even more common. Number 3. Oral decongestants, pseudoephedrine. Phenylephrine. They clear your nose fast, but they do it by narrowing blood vessels, not just in your nose, but throughout your body. That can raise blood pressure, increase heart rate, trigger palpitations. For someone with controlled blood pressure, this may cause a temporary spike. For someone with cardiovascular disease, it can be far more serious. That's why many heart specialists advise avoiding systemic decongestants after 60, especially with hypertension. Safer alternatives often include saline nasal sprays, humidifiers, local nasal corticosteroid sprays. Relief for your sinuses should never compromise your heart. Now we're moving into a more sensitive area. Number 2. Older tricyclic antidepressants. Medications like amitriptyline or imipramine are sometimes still prescribed, often for nerve pain. These drugs can lower blood pressure suddenly when standing, increase resting heart rate, affect electrical conduction in the heart. In older adults, this can increase fall risk or rhythm disturbances. That's why newer antidepressants are often preferred today for seniors. If you or someone you love is taking one of these medications, don't panic. But do ask, is this still the best option? Are heart rhythm and blood pressure being monitored? Mental health matters deeply, but treatment choice matters too. And now we arrive at the most debated topic. Verta 1. Calcium supplements. This may surprise you. For decades, calcium supplements were recommended widely for bone protection. But research over the past decade has raised questions about high-dose supplementation and cardiovascular risk. Calcium from food is absorbed gradually. Calcium from supplements can create temporary spikes in blood calcium levels. Some researchers hypothesize that repeated spikes may contribute to arterial calcification. The evidence is mixed, not definitive, but enough to warrant caution. Important distinction: calcium from food, generally considered safe. High-dose supplements should be individualized. If you have osteoporosis, supplementation may absolutely be necessary, but it should always be guided by a healthcare professional who considers both bone health and heart risk. More is not better. Now let's zoom out. The real message. This video is not about stopping medications on your own. That would be dangerous. This is about awareness. After 60, the balance between benefit and risk shifts. Your heart has been working for decades. It deserves careful review of everything you put into your body. At your next appointment, bring a full list. Prescriptions, over-the-counter medications, supplements, vitamins. Then ask simple questions. Is this still necessary? Is there a safer alternative? Should anything be monitored? That one conversation can dramatically reduce risk. If this video opened your eyes, subscribe. We focus on practical, clear health information for adults over 60. Without fear tactics, just smart awareness. And tell me in the comments, which of these surprised you the most? Your experience might help someone else protect their heart. Take care of it. It's carried you this far.